and Julia Sondu, showing you where development is happening. Please come and join us. Ghana can become primary medical tourism destination, said Dr. Armstead. Dr. Rodney Armstead, president of LuccaHealth Medical Specialty Center, has said that Ghana can become a medical tourist destination for the entire West Africa region.
Availability and access to excellent healthcare services in Ghana could not be more important at this time. LuccaHealth provides specialty consultations and surgeries in a free environment. Our excellent team of doctors and nurses will demonstrate for you that we adhere to.
He said there are opportunities to improve healthcare. As such, LuccaHealth is here to bring the United States, US, medical quality, expertise and specialism to Ghana and to work with Ghanaian institutions and doctors to provide excellent health services. The investment in LuccaHealth far outstrips the investment in most other medical facilities in Ghana, Dr. Armstead says. But he expects an equally outsized return. Dr. Armstead expects a 50% increase in annual revenue compared to FY 2020, with a 30% operating margin and a 45% EBITDA. That would come from a robust 62,000 plus encounters, consults, imaging, diagnostics and procedures. But even more than the financial potential of LuccaHealth is its transformational legacy. Dr. Armstead says that opening the first LuccaHealth campus was one of his best days ever as a corporate leader. We so casually use the word transformational in the US around things that go on with healthcare in a very mature market. But I do believe that what we're doing in Ghana is transformational. We were clear what the destination was, but the journey is what people will talk about. That is the legacy. LuccaHealth partners with patients and their doctors to deliver specialty and same-day surgical care. Located in the heart of Accra and operating with US standards of safety, patient care and doctor-patient confidentiality, LuccaHealth Medical Specialty Center provides specialty and same-day surgical care. Using the latest innovations in medical interventions and leveraging our telemedicine partnership with New York University School of Medicine, the physicians and nurses at LuccaHealth Medical Specialty Center provide patient-centric care in moments that matter for our patients. Our clinical and nursing team is committed to delivering the quality of specialty care, same-day surgical interventions and modern diagnostics in Ghana that patients who travel for care find in the US, the UK and South Africa. At LuccaHealth, we are committed to ensuring patients receive the care the doctors prescribe, without having to wait or leave West Africa. LuccaHealth's world-class medical center attracts top doctors and surgeons from the US, EU and Ghana, combining specialized expertise with the latest medical technology. This allows us to deliver some of the best medical care in Africa. Our advanced medical center uses the latest tools and procedures, like minimally invasive surgery with small incisions. Our doctors offer a safe, patient-friendly environment to treat your symptoms and conditions with less pain and a faster recovery time. Our procedures often take less time and offer the ability to heal faster. Using advanced techniques and equipment means less pain and a quicker recovery. With appointments available now, our specialists will help you feel better. Brought better healthcare to sub-Saharan Africa. It's nothing compared to developing one in sub-Saharan Africa. That's what Dr. Rodney Armstead learned on his 5-year quest to open the first specialty practice and minimally invasive surgery center in Accra, the capital city of Ghana. LuccaHealth Medical Specialty Center has 2 campuses in Accra. One opened in November 2019 and the other in February 2020. Together, they will offer 11 specialties and minimally invasive cardiology, ENT, ear, nose, throat, and head and neck, gastroenterology, general surgery, gynecology, internal medicine, neurology, nephrology, ophthalmology, retina disease specialist, pain management, urology. Changing medical care in Ghana. In Africa, 11% of the population drives 25% of the world disease burden, Dr. Armstead says. That's people developing chronic illness like diabetes, hypertension and cancer. Those staggering numbers illustrates the need for the extraordinary specialty gap, whether it's a surgical specialty or a medical specialty, he says. That means people had to leave West Africa to get the care they need. Now they can get that care closer to home. We will bring these types of solutions not only to Ghana, but to West Africa, as a US-owned and operated center of excellence, delivering through a high-quality patient-centric model. We will become the referral destination, rather than people going to India, the UK or US for care. Why Ghana? Dr. Armstead, who spent time working in government during the Clinton administration before joining United Healthcare, was looking for private equity opportunities. Enter Cheryl Mills, CEO of Black Ivy Group, an investment firm with operations in sub-Saharan Africa. She is the former chief of staff at the US State Department who saw huge opportunity for investing in Africa. But which of the more than 50 countries in Africa would be the right one? The criteria for deciding where to invest included looking at the country's GDP growth trajectory, the status of its middle class, the stability of its democracy, and the country's history of embracing private investment. That narrowed the search to just 3 countries: Tanzania and Kenya in East Africa and Ghana in West Africa. Black Ivy was already working in East Africa, so it made sense to choose Accra, a thriving metropolis with more than 4 million people, as the hub of LuccaHealth in West Africa. You're not in America anymore. In the US, building a new medical facility simply requires identifying the demand and filling it. In a developing country, there are many more hurdles. That means the initial risk is much greater. Dr. Armstead had to convince investors that he could build the medical centers, attract doctors to work there, and drive customers to seek care. That's a big thing to convince investors around, because that's in contravention to how you would expand in the US, he says. Once the investment was secured, he had to negotiate the vagaries of Ghana. It requires a certain level of humility to understand that in order to navigate here, you have to really be here, you have to live here, you have to understand and embrace how they do things. For example, he says, just because something is written in a regulation doesn't necessarily mean it works that way. It's an important mindset hurdle you have to overcome. You can't do it from abroad. You have to be in Africa. This is the end of our program today. See you on Intervlog same time tomorrow. Thanks for watching. Please like and subscribe to my channel and press the bell icon to get new video updates. Thank you for watching Intervlog. Thank you.